Let's talk about the price you pay. The open enrollment period for people who get their insurance through the Affordable Care Act is coming to an end this month. Now, state and federal numbers are showing more people are moving to cheaper plans or dropping coverage entirely. Nationwide, signups are down more than 800,000 from last year for Affordable Care Act insurance. It comes after Congress did not extend those enhanced tax credits for people under the ACA. Those are known, or the program that's also known as Obamacare. That has led health insurance premiums to soar for millions of Americans. NBC News health and medical reporter Berkeley Lovelace Jr. joins us now with his reporting. Berkeley, I know NBC reached out to some states about sign-up numbers for 2026. What did some of them say about what's happening this year compared to last year?
Yeah, that's right. So we obtained data from 10 states that run their own Affordable Care Act exchanges. So we found that in 3 states, Idaho, Massachusetts, and Virginia, the number of people who have dropped coverage for this year has doubled compared to last year. In Pennsylvania, the number of people dropping has tripled, and officials there tell us that the total is still growing. And then in states like Kentucky, California, and New York, signups for new enrollees are down, and people are also choosing so-called bronze plans. And so these are plans that typically have very low premiums but very high deductibles. And so a deductible is the amount that you pay out of pocket before your coverage really kicks in. And Kate, these are really high. They can average from around $5,000 to $7,000.
Right, because you sign up for the cheaper plan, but if you end up with a big medical emergency, you pay a lot. Walk us through some of the things that could happen as people move to cheaper insurance or don't even sign up for insurance at all.
Yeah, so an example is a mom I spoke with in California. Her name is Sophie, and she gets her coverage for her entire family, including her 10-year-old daughter. And so she told me she chose a bronze plan this year, which came with a very high deductible. And over the weekend, she told me that her daughter hurt her wrist while playing, and she really wanted to take her to the emergency room, but she didn't because she was afraid of the high costs. And that's an example of what experts say we're going to see more of. So more people are going to be putting off care. They're going to be delaying care, even skipping medications. And we're going to see more people wait to go to the hospital until they get seriously sick. And if they can't pay for that care, then that will fall onto the hospital and it will fall onto taxpayers. And also experts are worried that some hospitals will even close because people won't be able to afford their care and they won't be able to pay for those services.
And Berkeley, we've talked a lot over the last few weeks about Congress trying to fix or extend these subsidies that people were getting last year. Where does that stand?
So it's really unclear right now whether Congress will be able to reach a deal. So the House did pass a bill to extend the tax credits for another 3 years, but the Senate is also working on its own version. So it's unclear whether they'll be able to come together to work on an agreement for that. And then meanwhile, President Donald Trump has suggested that he would veto an extension of the tax credits as well. So right now it's really up in the air, Kate.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.